Welcome to the Operation Smile Reviewer's Guide for grading cleft severity of a bilateral cleft lip. In bilateral cleft lip patients, there is a graduated severity of dysmorphology due to varying degrees of displacement of the lip, nose, and skeletal base. The Cleft Severity Index is based on defined guidelines that separate patients into Grade 1 through Grade 4 according to the progressive degree of lip and nose involvement on both sides of the cleft. Grade 1 describes a bilateral incomplete cleft lip. Patients typically have a relatively mild nasal deformity with a short hemicolumella and mildly displaced alar bases. Grade 2 describes a bilateral cleft lip in which one side of the cleft is complete and the other side is incomplete. The features of the resulting nasal deformity include a short hemicolumella, dislocated genu, greater displacement of the alar base laterally and posteriorly on the complete cleft side, deviation of the columella, and tip deviation toward the complete cleft side. Grade 3 describes a bilateral complete cleft lip with absence of the nasal floor bilaterally. There is a severe nasal deformity with a very short hemicolumella, posterior displacement of the alar bases, progressive dislocation of the genu, and increased slump of the lower lateral cartilages. In the basal view, the junction point between the mucosa of the prolabium with the mucosa of the premaxilla is posterior to a line between the alar bases. Grade 4 describes a severe complete bilateral cleft lip. In Grade 4, the premaxilla is severely protruded anteriorly to the lateral lip elements and often deviated. Grade 4 clefts have wide separation between the medial and lateral elements. Patients have severe nasal deformity with a very short hemicolumella, marked septal deviation, nasal tip deviation, and severely displaced alar bases laterally and posteriorly. In the basal view, the junction point between the mucosa of the prolabium with the mucosa of the premaxilla is at or anterior to a line between the alar bases. Thank you for learning about the Cleft Severity Index. For more information, please see the Surgical Outcomes Program Reviewer's Guide.